Hey, everybody. Welcome back to the Outcomes Rocket. Today, I have the privilege of hosting Terry Boch on the podcast. Terry is Clarify Health's Chief Executive Officer. She is a healthcare industry veteran with over 30 years of experience, and she's got a proven track record of bringing innovative and energetic leadership in building, integrating, and operating high-growth healthcare technology companies. Her industry experience spans payer, provider, employer, life sciences, and public sector markets across a broad range of strategic areas that include big data, analytics, care management, and many more. She's worked and held strategic executive level positions at companies like Diameter Health, IBM Watson, and the list goes on to include payers like United Healthcare and KPMG. Terry, I'm so excited to have you here on the podcast. Really thrilled that you're able to join us.
Thank you very much, Saul. I'm thrilled to be here.
Thank you. So, look, to begin with, I want to just start off by congratulating you on really your appointment as the CEO of Clarify Health Solutions.
Well, thank you. Yes, it has been, it's been a really exciting time, as you can imagine. And I'm learning a lot very quickly, but I'm really excited about the new role and the future of Clarify.
For sure. And so with your experience, the future is very bright. Can you share with our audience what excites you the most about taking the new role and leading the company into its new chapter?
Yeah, absolutely. It's a topic I can spend a lot of time talking about because I have a lot of excitement about Clarify. First and foremost, what I would say is just the depth and the breadth of talent across our team of clarifiers. It's a big part of why I joined Clarify, and we have this incredible team of people who are passionate and devoted to our mission of powering better care, improving outcomes, and reducing healthcare costs. I also, strongly believe that we are uniquely positioned to solve big challenges in healthcare. I've been, as you introduced me, I've been in this industry for now over 3 decades, and so it's refreshing to see the industry finally beginning to address some of what we've known to be misaligned incentives, and we are seeing big shifts in healthcare delivery model and financial reimbursement models in the move to high value care. So as we think about this massive transition for the industry, data and insights at the end of the day really sit at the core. They are foundational for all stakeholders, payers, providers, employers, consumers who are trying to navigate, through this change. And so what excites me is that here we are at Clarify. We are sitting today on this vast blended national data set across 300 million patients mapped to over 4 billion patient care journeys with deep analytic capabilities that we've built in the past decade and that we're using to drive measurable improvement in patient and business outcomes for more than 75 of the most reputable healthcare organizations in the industry. So, our unique combination of our data, of our technology, and our subject matter expertise is what gets me really excited. Even as I look at actually what we're doing, we're assisting payers and providers with better insights into pricing and performance transparency. We're equipping them with market intelligence to deliver superior cost-efficient care. And we're aiding providers in accelerating their growth strategies and provide stakeholders with these comprehensive patient journey insights through our advanced analytics. And then if we look beyond just the sort of the core data and analytics, we are equally excited about our customers who are actually realizing very significant value through our innovative programs that are specifically designed to help physicians to select cost-effective, high-quality care options for their patients, even when they aren't quite yet in a full risk or value-based care arrangement. And what I would say is I'm really excited about even work that we've done this past year to start to quantify our impact, and it's been substantial. It's resulted in billions of dollars of aggregated savings and revenue for our customers. For instance, I can give you a couple of examples. We collaborated with a payer in identifying close to $300 million in potential cost care savings for their value-based care incentives. And, in these programs, we're not just advising providers on, how to enhance care. We're actually doing it in a way that empowers them by giving them access to the Clarify tools, and really fostering trust and enabling the providers to make the good decisions, to proactively identify the opportunities and improve performance. And so, this kind of success, it exemplifies how the synergy of the data and the technology insights can do more than just solve specific problems, but it can actually help in improving payer and provider, collaboration, which we all know that's where the market's going. On the provider side, another great example where we helped a health system uncover $53 million to grow market share in one region just by uncovering over 50,000 chemotherapy and infusion procedures performed by competitors so that they could look at that. And it played a very pivotal role in bolstering their hospital outpatient and ambulatory surgery center market share just for that specific service line. And again, sort of demonstrates, how our insights can lead to top line growth, in addition to the cost reductions that I mentioned. So I know that was a lot, but just, to answer the question on my excitement level, I mean, it spans across, our people, our customers, our differentiated capabilities, and our ability to have an impact.
No, thank you for that, Terry. Some very tangible examples there and certainly exciting. I mean, billions of dollars in savings and also opportunities to help with top line, and that collaboration between payers and providers is huge. So certainly very exciting to hear your vision about this. You've had a very impressive career in the healthcare technology industry with experience in various different leadership roles. How do you plan to leverage your expertise to further Clarify's mission in empowering healthcare organizations?
Saul, I mean, I've devoted my entire career to healthcare. It's an industry that I am wildly passionate about. But over the past specific 20 years, I've become very highly focused on healthcare technology, and because I knew that was what could transform this industry in a very material way, and I wanted to be part of that. So, most of my time on the healthcare tech side has been really about building and expanding high growth healthcare technology companies across a wide range of domains. So, part of the very early movement of electronic health records when EHRs first hit the market, this was even before meaningful use era, to population health management, data analytics, interoperability, provider and consumer engagement tools. I mean, a pretty wide range of healthcare technologies. But the common theme across all of these has been sort of my unwavering commitment, passion, to find ways to empower, healthcare organizations by leveraging data and insights in a very meaningful way. So, I see this as an opportunity to bring all that experience together to continue to carry out that vision and that focus, and to do it at a time when I really do believe that we will see more change in the next 5 years of healthcare than I've seen in these past 20 that I've been, highly focused on the healthcare technology side.
Yeah, and change is happening fast. So it's exciting to hear that you've been ahead of the game, and there's big opportunities for you guys to take advantage of. Jean Drouin, the founder and former CEO of Clarify, he's, as I understand, will continue to be involved with the company as a board member and senior advisor. How do you envision collaborating with Jean, and what role will he play in Clarify's future?
Yeah, Jean he has achieved remarkable success in building the company, and I am deeply honored to assume this leadership role. Jean and I had an opportunity to work together, obviously, before this transition. He and I will continue to work very closely together as we, to ensure a smooth transition. And we will all continue to draw on Jean's extensive wealth of knowledge and expertise, both on the business but also within the industry. And I know he'll be an invaluable resource for our continued growth and success, including, his continued work on the board.
Thank you, Terry. Yeah, he's a great leader, and certainly exciting to hear you guys will continue working together. I've had the opportunity to really have chats with a lot of the team over at Clarify, and really just understand that Clarify Health is known for its analytics and value-based payment platform. Could you provide some insights to the listeners today on your strategic vision for Clarify Health's growth and impact in healthcare under your leadership?
Yeah, so if you take a step back and you look at the statistics, right, that many of us have seen, and that point to the fact that people in the United States today are experiencing the worst health outcomes, that the U.S. basically experiences the worst health outcomes among any of the other high income nations, despite spending the most. And the imperative for all of us is to demand better value for our healthcare investments. And so when I think about that, and I think about our vision and our opportunity, a big part of this is just continue to build on the offerings that we have today. We are uniquely positioned, to not only guide payers and providers in navigating this changing world of care delivery models and reimbursement models, but also to support other stakeholders too. And we're realizing, right, that there are many other organizations, whether those are benefit consultants or employers or other organizations that need access to healthcare data to move their business forward. And I think we are going to keep an eye, certainly, on that and those needs. There's also the fact that, our extensive data assets and insights that we have at a national scale, that data asset is something we will continue to invest heavily in. It is what positions us as a critical partner and capable of driving, some of the substantial improvements that I had referenced earlier, both in affordability and outcomes. So we absolutely will continue to invest heavily there. We are going to also look at ways in which we can continue to tailor that data, the data and the insights to address very specific needs of the market. So ensuring that information is finely tuned, sort of fit for purpose at a use case to resolve the most pressing issues. So that's another area of focus. And then I would say what I am really excited about is how we are positioned to support the industry to this move to value. And what's interesting is if you look at the way the technologies have evolved in healthcare, many of them have been built to support core functions for a provider or core functions for a payer. They haven't necessarily been built to sit in the middle to support the kinds of models that are being built today, where payers and providers are clearly converging, risk is shifting, and the care delivery models and the financial reimbursement models associated with all of that shift. So we really see us as, being as an opportunity for us to sort of sit in the middle and basically, support that convergence. So will continue to be another area of focus for Clarify.
That's great. And, having that role really could be transformative. It's so complex that, a lot of the details get lost, and having that data set, I think and the analytic capability is a huge benefit, as being kind of in the middle. So the healthcare landscape, as you mentioned, Terry, it's constantly evolving. How do you plan to address the complexities of the industry and make healthcare more accessible and affordable for Clarify's customers?
Yeah, at Clarify, I mean, we believe that the industry must fundamentally rethink the way that healthcare is both paid for and delivered. We're supporting the insights needed by payers and providers and other stakeholders to ultimately lower total cost of care and support these alternative payment models that I mentioned. Um, but really, at the end of the day, what we're delivering is a transparent source of truth, right, on performance to accelerate the adoption of these value-based payments. And I mean, the results are proven. Our customers have been able to simplify contracts, make performance transparent, identify opportunities to improve care. But also, we have to recognize that much of healthcare is still delivered in a fee-for-service model. So we're also working with payers and providers to drive the adoption of high-value care in a way that supports that transition to value-based care. So, for example, that's why we built that program I mentioned earlier, but it's why we built a program that uses behavioral economics that connects sort of clinical performance with financial incentives. And it focuses on the impact where decisions are being made, with providers at the point of decision and to guide patients to cost effective, high quality care options. And so, but the program is building a lot of trust between payers and providers in improving care and reducing care costs. So, that's really where I see our ability to drive, accessibility and affordability for our customers and for the industry at large.
Yeah, thank you, Terry. There's certainly a big opportunity in that for Clarify. And, there's something called Clarify Atlas platform. Can you tell us a little bit more about it and how it plays a pivotal role in delivering those actionable patient journey insights that you mentioned earlier?
Sure. So Atlas is the cornerstone of Clarify's comprehensive offerings. And what Atlas is it's a robust enterprise analytics platform that is designed to address the longstanding challenge in healthcare that we all know of, and that's the fragmentation of data. Disparate data sets have been a blocker for healthcare for a very long time. It is the thing that we are resolving with the Atlas platform. So our team is essentially using the power, the scale, and efficiency of big data to answer healthcare's most complex business questions for several stakeholders. So with Atlas, what we are able to do is we're able to map billions of patient journeys, and we have generated more than 18 billion AI powered predictions as part of this, which then generate actionable insights that can deliver better care, improved outcomes through smarter referrals, high performing networks, better care models, all of those things. But that's essentially, foundationally what Atlas does, and it is what is supporting, insurers, employers, health systems, benefit consultants, other stakeholders in eliminating waste, managing care costs more effectively, and improving the overall health and well-being, most importantly, of patients.
Thank you for that, Terry. Yeah, it's good to know that. And folks, if you're curious about Atlas, we'll definitely reference that as well as any of the other things we've discussed with Terry in the show notes. So make sure you check the show notes out. We'll have links there for you to to check that out. If you're any of those stakeholders that Terry just mentioned, definitely something I would check out if I was you. Terry, thank you so much for today. One last thing that I want to hone in on, just for the listeners to really understand, if you had to say what differentiates Clarify Health from other companies, what would you say it is?
Well, some of the things I've already touched upon and why I joined Clarify, why I'm here. If I had to sum it up, I would say certainly it's the unparalleled, breadth and depth of our data asset that's built on a national scale, and our ability to provide very meaningful benchmark data. So unlike other, analytics and data companies, we're just not working with customer data, but the reference that I mentioned earlier of the over 300 million unique patient lives of data that we have allows us to do very meaningful benchmarking at national scale, in addition to what we're able to do specifically with our customers' data. And that's a very important differentiation. Our commitment to data quality and innovation, we're very proud of the fact that we have 20 patents on our proprietary methods that we use to clean and enrich the data. And we know that's a very significant issue for organizations that are trying to use data and facing very significant data quality issues. I mentioned this earlier, and I just can't say it enough, Saul. The dedication back to the people, the dedication and the expertise of my colleagues that truly set Clarify Health apart from my perspective. It's their collective passion and commitment to improving healthcare for all. It makes us stand out. And so there's a big people part of that is a differentiation. And, I'd also like to add that I am very proud to tell you that key industry analysts and market intelligence platforms have recognized Clarify just this year 10 times for delivering high customer satisfaction and innovation in healthcare analytics, value-based payments, provider network management solutions. And, I call that out because for me, it's one thing for you to ask me or to ask another Clarify what differentiates us. But at the end of the day, the true test is how we're doing how the market views that we're doing, meaning the voice of our customer, the voice of the market. So to be recognized in this way and in the way that we have this past year, I think speaks volumes in terms of really what sets us apart.
Well, Terry, thanks very much. This has been just an incredible opportunity to connect with you. We're excited about the future of Clarify Health in your hands. And folks, we'll be visiting with Terry again. Terry, what sounds good to you? Next 3-4 months, maybe sometime in the spring?
Absolutely. That works for me. So I'll look forward to it.
Amazing. Look forward to it too. And folks, stay tuned to our podcast to make sure you catch up on the latest with Clarify Health. Remember, it's clarifyhealth.com. We'll make sure to put all of the resources and things that we talked about in the show notes. So make sure you check those out. Terry, thanks again.
Thank you, Saul.